cutting of the fund from Syria is coming with like many risks in the public health. For example, the outbreaks, if you have like no hospitals ongoing, so that's mean increasing of the disease, and we cannot track it in somehow because the e-warn system is relying on the funding, for example, in Northwest Syria. Also the malnutrition cases. So we noticed like increase in the global malnutrition cases because of the cutting of the fund, for example. So that's need also an action and it's cannot wait and somehow. Mental health crisis also, cutting of the fund affecting this very vital like services in all over Syria. But I'm mentioning that's the gap funding from Northwest Syria because it's somehow it's more clear from other areas. The chronic diseases, what we notice in all for the NCD, like any interruption of the access to the NCD, non-communicable diseases, will cause like huge failure for that system, and it's like it's critical for the future. And of course, the maternal and infantile mortality rates will increase if there is no funding for the facilities. I know that in this area now we are relying on like building the governance of the system and restoring the basic services. But what's happening like because there is no resources enough, so we are facing like huge shortage in everywhere. If you visited like many like of the audience, I think that they visit hospital inside Syria and Damascus and Homs and everywhere, and you show that infrastructure there how being collapsed and also the equipment, the infrastructure, everything is like needed like huge maintenance and huge efforts need to be considered there. So again, like of course we are entering the area of recovery now, but still like the health cannot wait, and we need to take care of the people until the system is being restored like fully and somehow, and this will take time. If we are talking about the infrastructure, we are working in rehabilitation for the health facility in Northwest Syria and in south of Idlib, and south of Idlib and north of Hama. So, for example, Al Marra Hospital is a central hospital in that area, and now we are doing rehabilitation. But this is one out of 100 of the health facilities being collapsed or need infrastructure rehabilitation somehow, plus equipping, plus like working with the human resources. So many efforts, like still, of course, now we are in a new area, but still like the emergency in the health system is still there, and we need to invest there.
Cool. So thank you very much, محمد. That's a very, very rich answer. And I can say I was in Damascus about a week after the regime fell, and I myself was shocked because one, I knew that Syria's health system was centralized, but I don't think I realized quite what we meant by that. So, for example, the hospitals of about 500-600 beds are massive institutions, but we know that many of them may only be partially functioning because of a lack of healthcare staff, because of a lack of resource. And I have to say, I was shocked that some of the equipment that I saw in the former regime areas was not something I recognized. I saw defibrillators. I didn't recognize the defibrillators because they hadn't been replaced for nigh on 15 to 20 years. And I spoke of Syria's health system being fragmented. And what we mean by that is that there are areas which were around 2/3 of the country before December 2024 that were under former regime control. There's areas in the northeast of the country with places like Raqqa, Hasaka, Qamishli and others. And then the areas that Muhammad mentioned in northwest Syria, which are most of Idlib Governorate and part of Aleppo Governorates.